Hello everyone, my name is Dr. Joy Jeevan Kumar. I'm the Secretary General of Daisy Care Zambia. Today we will be looking at a preventable yet very common medical condition that affects our population, sexually transmitted infections, commonly known as STIs. STIs are spread via sexual behavior such as unprotected vaginal, anal, and oral sexual intercourse. It is possible to spread the virus via close body contact with an infected individual, mother-to-child transmission, blood transfusions, as well as sharing contaminated sharp objects such as needles. You might be wondering why it is important for us to educate ourselves about STIs. According to the World Health Organization, every single day over 1 million individuals acquire an STI. Yes, you heard me right, over 1 million individuals every single day. STIs are preventable conditions that lead to severe complication in our population, including those of a pregnant woman and her unborn child. Over the years, many drug-resistant strains have developed, as well as some which have no known cure to mankind. It is important for us to educate ourselves about this preventable condition, as prevention is better than cure. What are the causes of an STI? STIs are caused by various different pathogens ranging from bacteria, viruses, parasites, and fungi, 8 of which have been implicated for the greatest incidence of an STI. Chlamydia, syphilis, gonorrhea, and trichomoniasis are the 4 that have cures and can be treated at a health facility. The other 4 are caused by various viruses and have no known cures but can be managed. These are human immunodeficiency virus or HIV, human papilloma virus or HPV, herpes simplex virus HSV, or the hepatitis B virus. It is important to note that not all individuals who are sexually active acquire an STI. There are certain risks or risky behaviors that increase one's chance of getting an STI, some of which are having unprotected sexual intercourse, having multiple sexual partners at a time, incorrect use of condoms, having sexual intercourse while under the influence of alcohol or other drugs, sharing contaminated sharp objects such as needles, as well as indulging in sexual activity while being diagnosed with an STI or having a history of being diagnosed with an STI. Remember, having syphilis or herpes simplex infection can increase one's chance of getting HIV by 3-fold. It is important for us to identify the risky behaviors so that we can counteract them with preventive measures.
We now come to the signs and the symptoms. Some cases may present with symptoms while others don't. Being an asymptomatic individual, one may look healthy but still be a carrier, and this can still pass on infection to the partners. However, if symptoms do occur, they depend on the type of infection the individual has and the stage at which the infection is at. Some common symptoms and signs include bumps or sores on the genitalia, the oral and the rectal regions, pain during sexual intercourse, pain during urination, a foul-smelling penile or vaginal discharge. Now, this may or may not contain blood in it. Fever, lymph nodes that are inflamed, usually in the growing areas, lower back pains, rash on the feet, the hands, and the trunk. Now that we know the signs and the symptoms, we want to know when it is the right time for an individual to seek medical attention. It is advised that an individual should seek medical attention right before they involve themselves in any sexual activities for the first time. Now, this is very important because it helps an individual know the right information on how to practice safe sex, as well as the right recommendations on how to avoid the spread of infection. An individual who's already sexually active but does not really know if they have an infection needs to refrain themselves from any sexual encounters, thereby reducing the risk of spread of infection.
Screening is testing for a disease in someone who does not have symptoms. Most of the time, STI screening is not part of a routine healthcare checkup, but there are exceptions. The type as well as the frequency of a screening test will be dependent on the risk factors involved. It is recommended that all individuals between the ages of 13 and 64 are tested for HIV at least one time. However, it is recommended that it is done yearly for all those who are at increased risk. Other groups of individuals who are recommended to have frequent screening include gay or bisexual men, all sexually active individuals who do not use protection, all individuals who share needles and other sharps, pregnant women, as well as women who are over the age of 21. Women who are over the age of 21 are recommended to have a pap smear done every 3 years. A pap smear is a test that looks for any cervical abnormalities such as inflammation, precancerous growths, or cancer that is caused by certain strains of HPV. Through screening, we are able to have early diagnosis and treatment, thereby preventing the severe complications that arise with sexually transmitted infections. Diagnosis of an STI is made in a health facility by a healthcare provider. If you have any reason to believe you have been exposed to an STI, visit your health facility as soon as possible. Your healthcare provider will then ask questions regarding your sexual history, risk factors, and possibly any signs and symptoms that you're presenting with. This may be followed by a physical examination as well as investigations. Certain investigations that are done in a health facility include pinprick or needle prick rapid tests, blood tests, any secretions from the penile or vaginal area, as well as imaging studies to look for possible complications. Based on the individual's findings, the healthcare practitioner will then tailor a treatment according to the type and stage of the disease. It is important to notify your sexual partner so that they may also be tested and treated. Treatment of STIs varies from the type of the disease, possible complications, as well as the stage of the disease. It is important to remember that not all STIs have cures but can be managed. Some of the aspects of treatment include educating the patient about safe sex practices, the need for screening in the future for possible complications that may arise, as well as monitoring the use of the certain medication given. It is also important to provide social support to all members who are affected by STIs. Your healthcare provider will be able to provide you with answers to any questions you might have regarding sexually transmitted infections. Prevention and early treatment of STIs is emphasized by the severe complications that arise if left untreated. Different types of infections can present with different complications based on the type as well as the stage of disease. However, there are certain complications that are common, such as pelvic inflammatory disease, chronic pelvic pain, infertility, pregnancy-related complications such as ectopic pregnancies and fetal malformations, cardiovascular complications, arthritis or swelling of the joints, eye inflammation, as well as severe forms of cancer such as cervical cancer seen here in Zambia. Now let us look at some of the ways in which we can stay safe and prevent the spread of a STI. Abstinence, sticking to one sexual partner, the correct use of condom, communicating about safe sex practices with your partner, and avoiding the use of alcohol or drugs during or before sexual activity can all reduce the spread of an STI significantly. Other ways in which STI spread can be prevented is through vaccinations such as those available for HPV and hepatitis. Male circumcision has also significantly shown a reduction in the spread of an STI. PrEP or pre-exposure prophylaxis is a method used in preventing HIV transmission. PrEP is given to individuals who are HIV negative but are at high risk of getting the virus. When someone is exposed to HIV, PrEP works by preventing the virus from establishing a permanent infection. When taken daily, PrEP is highly effective in preventing the transmission of HIV.